Chemotherapy kills more than cancer. Did you know that 9 out of 10 oncologists will refuse chemotherapy if they had cancer? Researchers examined drugs such as Gleevec and Sunit, finding that these drugs may initially reduce tumor size, but afterwards cause tumors to metastasize aggressively. As a result, patients develop life-threatening tumors that oftentimes kill patients more quickly as a result of taking the drug. These cancer drugs are virtually ineffective at treating cancer, even killing patients who may have otherwise survived.
Tell you all about it when I see you again. When I see you again.
Cancer cells are regular blood cells that are basically in survival mode. To get them to change back into normal cells, you have to change your internal environment, and that starts with you. Along with balancing the biochemistry of the body, the mental and emotional state should also be balanced.
All over. And unfortunately, to get rid of this disease, the way that you do it, the way that you do so is by physically removing the tumor. So when it's coated on the walls, you physically remove the wallpaper. And in terms of dealing with the disease on the organs, there are certain organs that you can live without, like your spleen, your gallbladder, your colon, and some parts of your small bowel. And a lot of times, in order to remove the disease, we have to remove these organs as well. There are certain organs like the liver that you cannot necessarily live without, and that's like the big table in the room that you clean off and do your best to remove the disease process or the staining of the cola. And then after you've removed all disease that you can see, you temporarily close the abdomen and place 2 tubes, an inflow and outflow.
The problem is when you use toxic chemotherapy to try to kill the other cancer cells, all you accomplish is temporarily killing the outer layer of the non-stem cancer cells, which means you're killing the good ones. So when a person has multiple rounds of chemotherapy and everyone is pleased because the tumor is shrinking, don't get too excited, because what is usually happening is a killing of the non-stem cell and a production of a more dangerous cancerous cell that is drug resistant. Rebecca is 18 years old and has been living cancer-free for about 10 years now. When she first found out she had cancer, she knew she wouldn't take the chemotherapy route because she knew she would be dead. She took the smarter route, the alternative route. She now lives a very productive life and acts as any normal teenager would. Fun, caring, loving. Okay, now let's meet Joseph, who's been battling cancer for about 15 years now, and he is only 16. His mother thought having chemotherapy would be the safer route and the smarter route, but turns out it was.
I'm not looking for somebody with some superhuman gifts, some superhero, some fairy tale bliss, just something I can turn to, somebody